So there's three objectives to the talk that I'm going to give this morning. Firstly, I want to give you a little bit of background on radiation-related cancer risks to help you identify which patients and organs may be at highest risk of radiation-related cancer. Then I'm going to discuss some of the epidemiological evidence for cancer risks and medical imaging. This is from historical studies, but they were important for really first establishing that there were indeed cancer risks from repeated low doses of radiation from medical exposures. And then I'll finish with a review of the studies that have looked specifically at the cancer risks from pediatric CT scans. So first of all, then, some general background, and this has come from more than 100 years worth of observation of radiation and subsequent cancer risks, starting right back from the first radiologists who were actually the first people to develop cancers from their medical radiation exposure, and led, first of all, to the understanding that radiation could cause skin cancer and then leukemia. But there have been hundreds of studies of different populations since those early observations, and these have established that radiation is what we call a universal carcinogen. And that means that it can cause cancer in most organs. So there's really very few organs in the body that remain in the category of what we think is maybe not susceptible to radiation. So from the perspective of medical imaging, that means that almost any organ that is in with the field of the radiation exposure is going to be at potential cancer risk. We also know that ionizing radiation can cause cancer at any age, including in utero. But there is quite wide variation in the magnitude of the risks. And so we have these highest risks from some organs that seem to be particularly susceptible to ionizing radiation, and that's the red bone marrow, the breast, particularly during childhood, the thyroid, and also the brain. And so those are important things to think about also when you're thinking about what organs might be in the field of the area that you're imaging. It's very clear that children are at much higher risks than adults. We don't understand all the reasons for that, but it's been well established in essentially nearly all the studies. So as well as them being more susceptible, the total cancer risk excess cancer risk they experience over their lifetime after an exposure is higher because they have much longer life expectancy. And it depends on what they're being imaged for, but in general. But another important factor, though, when thinking about the life expectancy of patients, is that it looks like it takes at least 2 years for radiation-related leukemia to develop and more than 5 years for solid tumors. And so if you are imaging patients really in the end of life care, then you can see most likely they're obviously not going to be at risk of radiation-related cancer. On the other hand, for imaging for patients who expect to have a long life expectancy, then this total excess lifetime risk can really accumulate. So here I've shown an example for breast cancer, which demonstrates this impact of, first of all, the additional radiosensitivity at younger ages, but also if you consider the longer lifetime, how that translates into estimated excess cancer risks. So this is for breast cancer. If you have 100 milligray breast dose, which is obviously more than you get from most typical imaging examinations, it's just for demonstration purposes. So in a 2-year-old, we estimate that there would be nearly 20 excess breast cancers per 1,000 exposed children across the lifetime. And you can see this drops down really precipitously to once women are in their 40s and older, really much smaller risks. So I think this is one of the key take-home messages, and you see it again when we talk about the pediatric CT scans, which is that children much more radiosensitive and their total risk is going to be usually much higher. So why do we study specifically the cancer risks from medical imaging? Well, of course, I know all of you here who are attending the course, it's what you work on and it's what you are concerned about. From a perspective of a radiation epidemiologist, there's actually two reasons. One is to study the risks directly from these types of exposures, particularly because we know that the frequency of exposure is increasing and the types of exposures are evolving. So we want to be able to quantify the risks from these current exposures. And this can help us inform risk-benefit calculations.